Hi, my name is Dr. Walter Tsou. I serve as Executive Director of Physicians for Social Responsibility in Pennsylvania, and I'm very pleased to be part of this Clean Energy and Health Conference. The goals of my talk today are around why clean energy is good for your health, and also what are some of the health impacts of climate change. Some of the health impacts have been covered by our other previous two speakers, like around asthma and childhood environmental pollution. So I urge you to watch their excellent talks. The CDC put out this chart about the impact of climate change on health. And in the middle, the center there's the increase in CO2 with rising temperatures, more extreme weather, and then rising sea levels. And all that can impact things like air pollution, changes in the number of insects in our environment, allergies, water quality, our food supply, environmental degradation, and extreme heat. And I'm going to talk a little bit more about that in the next slide. So, for example, has overwhelming impact on our health and mental health. There's an increase in CO2 and methane, which leads to greenhouse effect and extreme heat and severe weather. And the more extreme weather means that we have very hot days and the presence of nitrogen dioxide and volatile organic compounds, VOCs, that can be converted into ozone, a powerful respiratory irritant, which can cause even fatality in people with borderline respiratory status. We're seeing more mosquitoes, insect-borne diseases, things that we never would have seen before in America. And we're starting to see the impact of our oceans rising and the saltwater intrusion into our freshwater aquifers, especially along the coastal cities like in the state of New Jersey. But it could also happen into Philadelphia because the salt water actually goes up the Delaware River. All that heat actually has an impact on our food quality, and we're starting to see drought, reduced plant production, and our animals are actually dying in the extreme heat. And of course, when you have extreme heat, it could actually force people to fight for water, and we can actually implicate war and forced migrations based on this extreme weather. The rising sea levels have led to flooding, and of course flooding leads to mold, increasing allergens, and when it really rains hard, sewage overflow and bacteria, which of course will impact our health. We don't have time to go through all these various factors because I want to get to the talk about what we can do about it. It's worth noting that we've started seeing record heat waves in Philadelphia, and in fact, this past summer was the third hottest on record in Philadelphia. This is all to say that there's something called the heat island effect, particularly in large cities like Philadelphia. That means that we're hotter than that of our surrounding suburbs, and this isn't due to a large extent because of the concentration of people, cars and vehicles, trains, the black top streets, and the asphalt topped roofs. All that actually helps attract solar radiation, and our city is a few degrees warmer than that of our surrounding areas. Even though it's a few degrees, that can be significant, particularly on especially hot days where the elderly and the shut-ins are not able to seek cooling centers. The city of Philadelphia has actually mapped out areas of the neighborhoods which have higher heat vulnerability. By that they mean that there's less trees, there's greater concentration of people, the roofs are often black rooftops, And there's a lot of car pollution in those areas. And those areas are more prone to have uh, high temperatures on very hot days. And the people who live there are much more prone to the effects of heat stress. So we're very concerned about heat-related illnesses in our city. Well, Philadelphia has the distinction of being one of the original discoverers, if you will, of heat-related mortality and published articles about this even back in the 1990s. Since then, the CDC has been putting out articles about heat-related mortality. On average, between 2004 and 2018, we have about 700 deaths each year. It's highest among men, those who are over 65, American Indian and Alaska Natives, and higher in both rural and urban areas. People with high blood pressure medications, who might have some compromised cardiovascular disease, those who might drink too much alcohol or abuse drugs, those who might have mental illnesses are more susceptible to heat-related mortality. And in the past, one of our solutions has always been to have them seek air conditioning in cooling centers. But with the new COVID-19, this has become much more tricky. And so we are still grappling with the best way of getting the elderly and those who are vulnerable into cooling centers. I want to talk about some of the impacts of climate change on health. And I want to start with vector-borne illnesses. The two major ones that we're concerned with in the United States are ticks and mosquitoes. By vector, I mean sort of insects that can transmit diseases to humans. And the two that I want to talk about, ticks, include Lyme disease and Rocky Mountain spotted fever. And then on mosquitoes, things like malaria, dengue fever, West Nile encephalitis or virus, and chikungunya, which is a very debilitating muscular achy disease. I'm not going to talk about that, but I should tell you that they're all carried by the Aedes aegypti or Aedes albopictus mosquito, except for malaria, which is carried by the Anopheles mosquito. Ask anybody who's had Lyme disease, they'll tell you it's just a terrible disease to have. It's the most common vector-borne disease in the United States. It's caused by a spirochete, which is called Borrelia burgdorferi, and it causes this bullseye rash, which is pathognomonic actually for Lyme disease. People also have fever, aches, fatigue, swollen lymph nodes, and headaches as common symptoms of Lyme disease. And if it's not treated early enough, you can have all kinds of complications like facial palsy, neuropathy, and it affects your cardiovascular system. So Lyme disease is not a fun disease to have. And increasingly, we're seeing a spread of Lyme disease in other parts of the country. In fact, if you look at the map of the United States, you can see that Lyme disease is predominantly in northeast and midwest parts of this country, but virtually every state has now reported a case of Lyme disease. In fact, there's something like 275,000 cases have been reported between 2008 and 2015, and Lyme disease is notoriously underreported because many doctors do not report the bullseye rash that they see. It seems to have a bimodal peak. It's particularly seen higher in young children and then in older adults. One of the things that we're seeing with climate change is that mosquitoes, which we have often seen in tropical areas, are starting to move north as our planet warms up. So you can see in these red circled areas that places like Canada and Siberia never ever had things like mosquitoes. But now we're starting to see that mosquitoes are starting to invade even unthinkable areas like Canada and Siberia. So that by 2080, we predict that the entire United States will have mosquito larvae in their states, and that we have to start being worried about mosquito-borne diseases. One of those diseases is dengue. Dengue fever is spread by the Aedes aegypti or Aedes albopictus mosquito. It affects some 40% of the world population who are susceptible to dengue fever. And just to give you an idea of how big this is, something like 400 million people get infected every year with dengue fever. Dengue is a terrible disease. First off, there's no treatment for it. I mean, you can treat the symptoms, and the symptoms are numerous: headaches, eye pain, muscle pain, rash, nausea and vomiting, bone pain, joint pain. The most common ones are nausea and vomiting, rash, and just general malaise and achiness. It's a really difficult disease to live with. There is a vaccine that's available, but it's only for those who've already had dengue fever once before. So it really doesn't help us. And what it means is that people who live in mosquito-borne areas, and increasingly that will mean us here in the United States, should be wearing insect repellent and long sleeve shirts properly on a continual basis. And to make things even more scary, asymptomatic carriers can be bitten by mosquitoes, and then they in turn, those mosquitoes can bite other people and spread the dengue fever. That's why it becomes very difficult to control dengue fever right now. Another mosquito-borne virus is West Nile virus, and to show that it actually has started to move, we have West Nile virus in Philadelphia. In fact, we test the different pools of water throughout the city, and we've tested some 563 pools in the city since May, and 61 of them have turned positive for West Nile virus. And just in the last week, 1 out of 3 of the pools that we tested were positive. And so it's not totally surprising to learn that just like 2 weeks ago, Philadelphia got its first human case of West Nile virus, which now brings up the whole sequence of concerns about wearing insect repellent, long sleeve shirts and pants, particularly as we are trying to fight off mosquito-borne diseases. So what does this all tell us? Well, it does mean that increasingly, in addition to us recommending people wearing masks because of COVID, we probably should be tell people to, as the climate gets warmer and hotter, to wear your hat, to put on insect repellent like DEET, to put on suntan lotion on people because of our concern about sun exposure, to bring your water bottle around, and plan ahead of time about how you're going to find an air-conditioned area if the sun gets too hot. I want to talk about Mauna Loa, which is on the Big Island in Hawaii. Now, Hawaii is always sunny, so imagine, if you will, that on top of Mauna Loa is snow. That's how high it is up in the air. And they've had a lab on the top of Mauna Loa that has been measuring carbon dioxide since the 1930s. And what they have found is that carbon dioxide keeps going up on the top of the Mauna Loa Observatory. And there's no other explanation for why CO2 should be going up on top of Mauna Loa except for the fact that it's going up in our atmosphere, which is why we have a lot of assurance that when we say carbon dioxide is actually polluting our atmosphere and causing the greenhouse gas effect, we know this is true based on our data from the Mauna Loa Observatory. Now, we don't think about whether CO2 really has some implications besides causing the greenhouse gas effect. But it also is something that some people say is positive for plants because plants grow on light, nutrients, water, and carbon dioxide. And the carbon dioxide, through a process through photosynthesis, is then converted to oxygen, which is what we breathe to keep us alive. But the carbon dioxide itself does not actually have the same impact on all plants. So, for example, we know that in the presence of carbon dioxide, poison ivy, ragweed, marijuana, interestingly enough, and weeds all grow precipitously. Well, what are the impacts of that? Well, we'll talk a little bit about that in a few minutes, but consider that if we have more weeds, a lot of people buy more weed killer and they put all that pesticide in the air, and that actually has some impact on our health. Another more important question, though, might be what is the impact of rising CO2 on the nutritional value of the foods that we eat? So common things like rice, wheat, potatoes, barley, we have found that rising CO2 levels actually decreases the amount of protein content of these essential grains that we eat in our diet. Now, interestingly enough, those things like legumes, which actually can fixate nitrogen as part of their growth cycle, they don't seem to have any change in their nutritional value in the presence of rising CO2. But it should disturb us, I think, to think what rising CO2 might have on our diet. Well, I mentioned, for example, that things like poison ivy and ragweed increase, and not surprisingly, that means that we have many more cases of people who come in with poison ivy skin rashes or coming in with allergies during the pollen season. So that has a direct impact on our health. And then I mentioned, of course, that with decreased protein content of some of our essential things like rice, potatoes, and bread, that actually will impact our own health, particularly those countries where they have borderline food insecurity, and they need every ounce of protein they can get. I mentioned earlier that sewage waste is actually a serious problem when there's heavy rains and it overflows not to the treatment plant but actually into our streams. Contaminated water is a cause of cholera, algae blooms, cryptosporidiosis, which is a type of parasite that we find in water, campylobacter, and leptospirosis. All these are things that we are concerned about when we have contaminated water. I'm just going to talk about the first two, cholera and algae blooms. Cholera is arguably the most significant of the water contamination bacteria. It's caused by Vibrio cholera. It can cause severe watery diarrhea, vomiting, muscle cramps. Here's a picture in the green of what the cholera bacteria looks like. And it affects something like 1 to 4 million people worldwide. This diarrhea can be so profound that it can actually kill you and dehydrate you within 24 hours. So something called oral rehydration therapy is essential to prevent people from dying from cholera. Algae blooms are also very significant. You can see right here outside of Lake Erie that the green algae bloom is actually impacting the fresh water supply of Lake Erie. And over on the right, in Florida, there's the red tide caused by a bacteria called Carina brevis. This is a terrible tide that it's affecting the drinking water and tourism all over Florida. These algae blooms are caused by a cyanobacteria or a blue-green algae. It's related to fertilizer runoff. Well, where's this runoff coming from? It's coming because of all these profound rains that are coming down, and it's washing off the fertilizer into these lakes and oceans, causing these algae blooms. It can kill the fish, which of course affects our own nutrition, or it contaminates the fish so it's not edible anymore. It can also contaminate drinking water, and that is all things that we should be very concerned about um, with these algae blooms. Finally, I'm going to end by acknowledging that um, climate change is a very stressful thing. If you see the extreme consequences of wildfires or flooding, you start realizing what a disaster this is for the mental health of individuals and an entire community. This is mourning that's happening right now in parts of California who have lost almost everything because of climate change. We see it also from flooding and the mold production and the potential allergens that are created uh, by the flooding that is caused by climate change. We see it in the shelters where we have to house people because they've lost their homes, and the stress of actually losing all your possessions and surviving merely by being on a cot in a shelter. And it's also affected not only in the United States, but worldwide. We have literally millions of people displaced living in refugee camps who are affected by the fact that they've had to leave their home either because of drought or flooding or fires, but they've essentially been displaced, and the mental health stress on their lives is also profound. So in short, climate change affects everything. It affects every aspect of our bodies, and because of that, it affects our health in profound ways, not just physically, but mentally. We have a climate emergency in this world. We have got to do something about that. We have less than 11 years to work on stopping carbon pollution, and it's very essential for us to do that, not just for helping to save the health of our planet, but the health of ourselves. Thank you. I look forward to hearing your questions over the next 2 weeks, so please send them to us.